Hi there, I'm Rozy.
And I'm Kate.
We just wanted to let you know a little bit more about our pre and postnatal yoga DVDs and why we decided to go with yoga as opposed to fitness or Pilates. Do you want to explain a little bit about that?
Yes, absolutely. My speciality is fitness. I trained as a fitness teacher primarily in 1991, and then I only found yoga when I was pregnant myself. Rozy, you're much more of a yoga specialist.
Yeah, I'm a yoga specialist and I work as a birth educator as well. So my whole interest really was in yoga from the start.
So I was bringing to the table really the sort of controversial. I have my devil's advocate hat on all the time, because most people, when they think about having a baby, and especially once they've had their baby, the key word is fitness and getting back in shape. All the celebrities, you see them pop back into their size 0 jeans as soon as they've had their baby. And I realised quite quickly when I was first of all pregnant and then I had my baby, just how long it takes you to recover. And actually what I realised after popping out a couple of babies was that if you do both the preparation and the recovery more gently, slowly, safely and effectively, it's a win-win. The recovery is quicker, more effective, and actually now I feel healthier than ever before, and our clients say the same.
Yeah, they do. And it's important to think about pregnancy fitness because we think we've got to get fit. You hear that, getting ready to give birth is like preparing for a marathon. And in some ways it is, but what we really want to do is two things. We want to prepare the mother emotionally for giving birth so that she can enter into her labour relaxed. And we also want to encourage through her own alignment her baby to adopt an optimal position for birth. If the baby starts off in a position that's going to help the labour to progress well, then things should go much more smoothly. Now, a lot of women will keep going with running, or they'll go to the gym, or they keep going with their normal fitness routines and even their strong yoga routines, not really adapting it much other than the absolute do's and don'ts that they hear about. However, this doesn't really help to prepare the birthing body because we need more elasticity as opposed to more tone in pregnancy. What's most important is to focus on alignment. Your body's changing every day. Every day you wake up in the morning and your baby's grown a little, there's more amniotic fluid around your baby. So it's finding your centre of balance on a day-to-day basis and coping with the changes that happen, which will increase backache, breathlessness, all the aches and pains you hear about that go through pregnancy. So these DVDs were our opportunity to create something really simple. We wanted to create an accompaniment to an exercise class or a yoga class, something that had lots of short sequences that you could do on a daily basis. So if you had 10 minutes or you had 20 minutes, you could just do a little bit of work to help you stay in the alignment that you'd found through your yoga class or through your specialist fitness class.
And I think one of the key words there is simple, because when I started doing these exercises, I was kind of waiting for something more, especially postnatally, when you kind of think, you've got the belly and you think, right, I need to be sweating, I need to be jumping, I need to be burning this. But if you do that too quickly, quite literally, the bottom can fall out of your world, or the world can fall out of your bottom. So what we've done is concentrating on yoga. We've stripped right back to really, really simple but very effective. They're deceptively easy, the techniques that you need to use to repair you from the inside out before you go back to your other fitness or start a new fitness regime, because after doing this you will feel stronger from the inside than ever before.
Yeah, we do say this on the DVDs, that it takes 9 months to grow a baby and it takes at least 9 months to close your body again after you've given birth. And most women are under the assumption that after they've had their 8-week postnatal check, they can go back to the gym or they can start running, and actually their pelvic floor and their abs are in no state to do that. So we did work with Birthlight and we did use their 5 steps to closing the body postnatally, which is essential before you do anything else. And that's the first sequence we recommend from after you've given birth. So you can start playing with that immediately after you've given birth, as soon as you feel ready, rather than as soon as you feel you should. The most important thing you can do postnatally is to bond with your baby. And remember that your baby's weight is a guide for you as to how much you can carry and what's actually good for you. The first month after you've given birth, your cervix is very vulnerable, the uterus is vulnerable, and it's really important to close the body. And those 5 steps on the DVD, the postnatal one that Kate teaches, really do help to stabilise the pelvis, to realign the spine and to realign the shoulders and the sternum.
The other thing that's crucial, which as an aerobics, as a gym bunny, I found really hard when I started doing yoga, is the breathing and the relaxation. But both for pregnancy and for postnatal, when you've got a baby, and to be totally honest, even if you're the most natural earth mother in the world, first babies are pretty stressful. It's a 24-hour, 7 job, which you've had no training for usually. And some people are doing it on their own, without mum nearby, without sisters, aunties. So it's pretty stressful. And what I found, even though it was the hardest thing to learn and be patient with myself about, was the breathing, connecting with a deep belly breath. And actually, postnatally, breathing properly is the best thing to tone you. It's like just breathing and you're doing better exercise for your belly than sit-ups or planks.
Yeah. It's really true. It is really true. And the breathing is also providing the oxygen to your baby when the baby's in the womb, so that's really good for keeping the placenta healthy. It also teaches you to breathe deeply during labour, so babies don't need to go into distress, fetal distress, because they're getting more oxygen through the mother's breath. And postnatally, it's that lifeline between having lots of mini relaxations as opposed to expecting to sleep through the night, which you're not going to do for a while, probably.
And if that's the other thing, is relaxation. When I went to my first yoga classes and I was told, or I discovered that we had to lie on the floor with our eyes shut for 10 minutes, I was horrified. My eyes were flicking, I was planning the next day of work that I had to do. So the fact that first of all you learn how to breathe, and just breathing relaxes you, and through your breath relaxes your baby, I mean, it's a win-win. It's a win-win situation. And as Rozy said, you're not going to get 10 minutes to turn out the lights and be quiet because your baby needs you. If you can learn how to do these mini relaxations, which is what we focus on in the DVD, as well as giving you a really big, beautiful, full-hour practice with a full-on, gorgeous relaxation with beautiful music at the end for when you do get the chance to spoil yourself. If you can learn to relax with these little mini techniques anywhere, at any time, when your baby needs you, then that's the best thing that we can teach you.
It's that multitasking that mothers do.
Yeah.
So you learn to relax and deepen your breath when you're feeding your baby, or you learn to get yourself back to sleep once you've settled your baby in the night. And also, if you think about it in pregnancy terms, if you learn to relax when you're pregnant, you're downloading the relaxation program to your baby. We are affecting our baby's nervous system because they're growing in our wombs, and their nervous system and our nervous system is linked. So if you don't know how to relax, and you're one of those women that says, oh, I never relax, I never sit still, it's really important, if you want a baby who settles more easily and who sleeps better and digests better, to learn to relax. You're investing in your baby's health as they grow into adulthood. It's really, really important. And it also goes back to what we're doing on the DVDs, both in the pregnancy DVD and the postnatal one. We're looking to give you the stability and the alignment to be able to carry more babies in the future, to heal postnatally every time from each birth, and then to enter into the menopause in a way that you're not going to be causing a disservice to your knees, your ankles, your hips, your pelvic floor. Because we know from years of research, particularly through Birthlight, that how you maintain yourself, how you look after yourself in your pregnancy and postnatally does affect your menopause. So we want to look after you long term, and we want you to be able to resume normal fitness and normal yoga classes sort of 6 months to 9 months after you've given birth, feeling really strong, really centered from the inside out. You must have heard about how sometimes the stomach muscles can separate, and that isn't helped at all by going back to the gym or going back to normal exercise and yoga too soon. So there's lots and lots of different aspects that we cover. I mean, the DVDs are simple. They're simple practices because we wanted you to be able to learn them quickly and to practice them on the go whenever you want.
And baby brain means that you'll need it simple. So no matter what you're used to, no matter how hardcore your fitness regime is or how much you think that you don't want to do any other form of exercise, know that actually after years and years of research and practice and experience ourselves of having children, when you're pregnant and your postnatal, what we've put on the DVDs are the most useful things for you, both to care for you during pregnancy, during your time with a new baby, which is stressful for sometimes them as well as you, and also for the rest of your life. So bear with it, and know that this is the very best thing you can be doing for yourself.
Yeah, and also it does make sense that a good 20-minute relaxation, if you get used to sleeping with your baby, for example, when they have their nap in the day, you're getting what is the equivalent of something like 3 hours sleep in terms of having a deep relaxation. So like we say, it's these mini breaks. And on the DVDs, we do offer a chair practice. We teach you some alignment tips for moving around in your daily life. This is all to prevent things like pelvic pain and backache from getting severe and therefore ending up in pain later in your pregnancy. And what I will say is I've never been fitter and healthier than I am now. I've never been stronger in my core. I have a 14-year-old daughter. You have 2 children as well, don't you? And I know that I've learned to be therapeutic in my body. I've learned not to push and punish myself in a way that isn't nurturing and nourishing me. And as mums, we need to nurture and nourish ourselves because we need to be there energetically, physically, emotionally for our children and all their needs.
And I do karate, I still love hardcore aerobics, I still do a bit every single morning. But for me, my most important exercise for me, for my body, for my brain, that makes me a better mum, a better wife, a better person, a better friend, a better daughter, is yoga. So give it a go.
Give it a go. I only do yoga, by the way. But I do strong yoga now, and I do much stronger yoga than I did before. So, you know, it's all in the DVDs.
Yeah, good luck with everything.
Downloads. Have the best experience of becoming mums, and best of luck with everything.